Hi everyone, exciting news in metastatic breast cancer. We have had 3 press releases for 3 pivotal trials, one for triple negative, one for HER2 positive, and one for hormone receptor positive HER2 negative. These trials are likely going to change the standard of care for first-line therapy of all 3 breast cancer subtypes. Now, these are press releases, meaning we don't have the official information yet. We just have a press release saying, hey, this study was positive, it met its endpoint, but we don't know the exact numbers and the exact results. So let's go through what these 3 are. The first is the SERENA-6 trial, and this trial is really exciting. This looks for patients with hormone receptor positive, HER2 negative, or HER2 low, as long as you're not HER2 positive. And these patients were on first-line therapy for metastatic breast cancer with endocrine therapy with an aromatase inhibitor and a CDK4/6 inhibitor. And what they did in this study was they did blood work and they tested patients for ESR1 mutations. And if you develop an ESR1 mutation, it means your cancer has become resistant to an aromatase inhibitor. Now, right now, this is only used in the metastatic setting. And so in this study, if you had an ESR1 mutation develop, they switched the aromatase inhibitor to a SERD, selective estrogen receptor degrader, called Camizestrant, and continued on the CDK4/6 inhibitor. So again, we don't have the results, but the press release stated that their results were positive, and so that this early switch approach, switching therapy before progression developed on a scan, improved outcomes. But exactly how much remains to be seen, and we are going to see the results of the SERENA-6 study at ASCO in just a few weeks. Moving on to HER2 positive, we have a press release for the DESTINY-Breast09 trial. So currently, standard of care first-line HER2 positive metastatic breast cancer is a Taxane chemotherapy with Herceptin and Perjeta, and those are anti-HER2 drugs. DESTINY-Breast09 looks at THP, Taxane, Herceptin, Perjeta, versus trastuzumab deruxtecan, which is Enhertu, with Perjeta. And again, the press release shows that Enhertu and Perjeta performed better than THP, but again, by how much remains to be seen. And we should see the results of DESTINY-Breast09 at an upcoming meeting, but I don't know which one. And then lastly, we have the results of the ASCENT-04 trial for metastatic triple negative breast cancer that is PD-L1 positive. So currently the standard of care is pembrolizumab or Keytruda with chemotherapy if someone is PD-L1 positive, or chemotherapy alone if you're PD-L1 negative. So what ASCENT-04 did for PD-L1 positive metastatic triple negative, it was patients either received chemotherapy with Keytruda or sacituzumab govitecan, which is Trodelvy plus Keytruda. So again, this release did reveal that sacituzumab govitecan and Keytruda performed better than chemotherapy in Keytruda. So again, we don't know how much will be presented in an upcoming meeting, but these are huge press releases, 3 major studies in all types of breast cancer in the metastatic setting, and really, I think, has the potential to transform first-line therapy for all 3 metastatic breast cancer types, which is just unheard of to happen altogether. So I will, of course, update you as we get the actual study results and as we have more information. But in the meantime, let me know any questions or your thoughts on hearing this information.